For someone who is in a very relaxed nervous system state, their tinnitus is often less intense, milder. It's not an issue. They don't notice it as much. Could you comment on the brain science of how does that happen?
It's sort of how we have evolved. The whole idea of, well, when I'm calm, my tinnitus is actually less intrusive. When calm, you've now learned to incorporate what's so in our lives, and it no longer is being perceived as a louder noise. It isn't actually louder. It's only louder compared to what we think. Loudness is a comparative term.
Hey, it's Dr. Ben and Dr. Priscilla. I'm here at our San Francisco Treble Health Tinnitus Treatment Clinic in the sound booth. I wanted everyone to know that if you are looking for a way to reduce your tinnitus, one of the best ways to do that is talking to a specialist on my team. We offer free consultations. So click the link below if you'd like to have a telehealth consultation from home, where you can speak to someone on my team who can guide you towards whatever solution is appropriate in your case. Click the link right below to schedule that consultation, and we'll see you there. Now back to the video. Hey everyone, this is Dr. Ben Thompson, founder of Treble Health. We're here for another insightful podcast episode. Today's guest and I will focus on keys to unlock stress and the nervous system. If you have tinnitus, also pronounced tinnitus, ringing in your ears, and are looking to reduce its impact on your life, this may be an important video because you might not have heard this perspective before, and I found nervous system regulation for tinnitus outcomes is very important. Now, a little bit about today's guest. Dr. Fred Moss is a psychiatrist and graduate of Northwestern University Medical School with nearly 40 plus years of clinical experience working with clients. Over his career, he's become a leading voice for a more human-centered approach to mental health, challenging conventional models that rely solely on diagnosis or medication. Dr. Fred is also known to be a non-diagnosing psychiatrist, author, and teacher. He's the author of multiple books, and I brought him on the Treble Health podcast today to discuss with me how stress and nervous system regulation impact chronic conditions like tinnitus. Fred, you mentioned to me earlier that you yourself have tinnitus. Let's start with that. What exactly do you hear, and what's your understanding of your own tinnitus?
Yeah, so I've been a hearing aid user. So first of all, thank you for having me on, Ben. It's really great to be here. I look forward to this conversation. I've not had an open and honest public conversation about this particular topic ever, so it's not like I've had a rehearsal about this. And I appreciate the opportunity to speak from what I know is so, as far as my education, my passion, and my own hearing loss. And over time, I believe, especially over the last couple, 3, 4 years, I've noticed an increase in my sense of tinnitus as well. And so it isn't overwhelming. I wouldn't say it's overwhelming, although just as recently as last week, I was with my wife and I think we were staying in a hotel and I was, my ears are ringing and it was clearly quiet and it was nothing I could do. I want to cover my ears to block the tinnitus, but that doesn't work because the tinnitus is coming from within. And so the volume doesn't change, the intensity doesn't change, and the presence doesn't change if I cover my ears, which is like the natural thing to want to do. So then there's this concern that I have that maybe there's something wrong with me, or maybe I'm going crazy, or maybe it's representative of, something, maybe I'm hearing, the whole idea in psychiatry is that hearing voices or hearing things is a very significant symptom in the world of psychiatry, and that'll sometimes even drop you into a hospital setting. Like if you come into an emergency room and say you're hearing things, that might be good enough to actually get you a psychiatric diagnosis. And in this case, that's not that at all. I believe there is there's a collective community understanding that tinnitus is something real. What's more interesting, though, is that when it's going on, and I imagined even as recently as last week, and I guess in some ways anticipating our conversation today, that it could get worse so that it would make it so that I would have difficulty actually falling asleep due to the noise, And it was like, wow, if that would happen, if it would get worse, that would be very difficult. How would I manage that? And that's what I think we're really talking about the same thing here with this idea of nervous system regulation, of getting conscious to what's so in the world. And what I like to say are, what are the conditions of the game? What are the game that we're playing? What are the conditions of the game? And what do I mean by that? Well, we look at a football field, it's 100 yards down, 100 yards between goal lines. I believe it might be 55 yards from across. I'm actually not sure about the width. But here's what I know. That's not changing because I complain about it. That's not going to change because I think it should be 90 yards or I think it should be 110 yards. That's just the name of the game. The game gets played between these 5-yard grids, and it gets played 100 yards between scoring points. So in the world of this, once I become calm and aware that this thing that is somehow disturbing is now with me, I can actually adjust myself to have this become my baseline. You see, it is only disturbing me with a memory of what it used to be. You understand? It's not really a disturbance unless I compare it to what I think it should be. So when I have a sense that it should be different than it is, that's when I have now manifested a significant problem. So some of the work that I've done, some of the compiling of work that I've done has ended up in a document, or we'll say a strategic, let's call it an intervention, called the Moss Method. And the Moss Method looks at 20 ways to calm ourselves inside of managing our own nervous system responses. There are 20 ways, and I didn't invent any of them for sure, but I was able to compile them and put them in neatly into a packet. And they include things like you've heard of before, things like gratitude, or things like nature, or things like meditation, or organic nutrition, or significant hydration, keeping yourself very flowing in hydration, keeping yourself steady and on the ground. Like, what does it really mean? Like creativity, art, music, dancing, singing, drama, cooking, writing, gardening. And also, what about spirituality? Where does that fit in our life? And what about service? Where does that fit in our life? What about self-pampering? Where does that fit in our life? What about sleep hygiene? Do we turn off our electronics, a couple hours before we go to bed? Are we able to slow ourselves down and ease ourselves into that beautiful state of sleep? Because here's the thing, there is no doubt that if we see this and feel this tinnitus, I believe it's the pronunciation I'll use from here on in, understanding that both work, is tinnitus. So when we get that tinnitus is, if we see it as a ringing of a bell, it's like, or a ringing sound, as if it's an active bell ringing, then it's going to be very hard to calm ourselves down in the face of how we see it. So one suggestion I have is, and I think I'm saying this now for the second time, or maybe the third time in this answer, is to shift how we see this experience. If we see it as an interface between what could or couldn't be, in other words, it should be or could be different than it is, and I'm disturbed that it's not, then we're going to be generating stress. Once we incorporate it in, just being who we are and what is so, we have the possibility of considering that as being a significant condition of the game. And the idea then is that we no longer have to see it as, we really don't have to see it as an intrusive experience, but one that has now become incorporated as what's so. For instance, again, I guess I'm talking more about the interface between tinnitus and insomnia, but I know that it also spreads certainly into a sense of anxiety and or depression, or, resentment or anger. When I moved to Los Angeles, the first time I moved to Los Angeles, there was garbage trucks every morning. And it was so loud. There was no way I was ever going to get to sleep. There was no way that, I would go to sleep knowing that I'm going to wake up at 4:45 when the garbage trucks come. And what I later learned is that I could actually, once I recognized it as being so, it could actually flow into being part of the condition of the game. And before too long, I was actually sleeping through the garbage trucks coming. And I wonder if that's something that can be used inside of this experience as well, where I'm not angry about its presentation, where I'm not scared or sad by somebody actually ringing a bell, which would be very disturbing. Can I incorporate it into my everyday life and monitor my own nervous system regulation in such a way as to treat it as less of an intruder, less an invader, and more something that's simply what's so, and thereby actually decrease the subjective experience of the loudness of the tinnitus?
Well, let me jump in here. Thank you so much. So one reason why I wanted to have you on is to bring more psychological specialists into this world, because we know that tinnitus is not a psychological or psychiatric condition. However, it creates stress, it creates anxiety, it creates insomnia, and you and your professional community tend to be the best experts at solving those issues. So in some ways, improving the anxiety, improving the stress response, improving the sleep actually does a lot to improve the tinnitus. And Fred, I wanted to just discuss and zoom out a bit. Why is this? Why should someone care about their nervous system? Well, tinnitus is a condition that amplifies or decreases from the limbic system. And I'd like for us to touch on that for a moment. So, for someone who is in a very relaxed nervous system state, their tinnitus is often less intense, milder. It's not an issue. They don't notice it as much. If someone has significant stress in their life, their nervous system is really out of balance, tinnitus is often louder, more intrusive. Could you comment on the brain science of how does that happen?
Well, that's an very interesting finding. So I think that, it happens in that everything is hypervigilant when we become stressed. It's sort of how we have evolved. So our listening selves, our seeing selves, our awareness selves get lit up when we're stressed. It's just sort of how we evolved. I think you've probably heard references to like saber-toothed tiger before, so that we could be aware of the saber-toothed tiger waiting for us on the other side of the Walgreens over there. And, if we become more aware, that's when, things get lit up. So the hairs or the receptors actually get activated in that sense so that we can be present. So I think that's how and why that happens. To the whole idea of, well, when I'm calm, my tinnitus is actually less intrusive. I wonder if it's actually a function of the previous thing that I said, that when calm, you've now learned to incorporate what's so in our lives, and it no longer is being perceived as a louder noise. It isn't actually louder. It's only louder compared to what we think. Loudness is a comparative term. And so when we get that that level is the baseline, we can actually calm ourselves down. And it probably works in reverse as well. So when I'm feeling calm, the sound of the tinnitus would be less because I've now reached myself to a space where I might be able to consider this so-called ringing in my ears as being a condition of the game. And when it's loud, it's more of a result of my hypervigilance and all my sensory experiences that is present so that I could be at least available to take on that so-called saber-toothed tiger.
Well, I'll go one step further that in my clinical experience working with tinnitus patients, what I've seen is that the patients who are able to get their nervous system in better health, closer to homeostasis, they tend to have faster and more effective tinnitus treatment outcomes, right?
Yep.
So let's discuss that for a moment. This is the part that anyone who's listening who has tinnitus should care about, is how to get an edge to get better results with reducing their tinnitus or reducing the perception. It is a subjective condition, right? So the perception is everything here. If the relative intensity is lower, that is better quality of life. That's a positive outcome. So let's talk about some simple, fundamental, really, approaches to how to get a healthy nervous system. What should someone with tinnitus start thinking about? Just what should anyone start thinking about in terms of how to improve their nervous system health, Fred?
Well, again, I think, when really looking at the nervous system and the interface between the parasympathetic and the sympathetic nervous system, when are we active? What is really working behind the scenes? We have an opportunity to keep ourselves grounded, keep ourselves stable, keep ourselves steady, oriented, and aligned. And we have that opportunity by taking on simple practices. Again, calmness is a preferred state in the face of, choosing between calmness and stress. And although sometimes stress is the proper response and actually prepares us for what's coming around the corner. But when we really look at what is the care for nervous system, I think the first care for nervous system is understanding or having some wisdom as to how your nervous system generates and how and why your nervous system generates the experiences it does in the first place. So whether it be, a fight and flight, or whether it be freeze, or whether it be fawn, or whatever it is that we're doing inside of our nervous system, we have the possibility of incorporating the impact of the experience in such a way as to leave us either calm or stressed. What can we do? I think this is the essence of your last question, is what can we do? How can we care for our nervous system so that we're better prepared, or maybe put ourselves in a better position to receive a more favorable outcome to any tinnitus treatment options? it lands in the same place as the Moss method. I just think that if we find ourselves being able to meditate, being able to find that we are not our experiences, we are not our emotions, we're not our physical sensations, we are not our sensations, and we're not our circumstances. Although those things are all happening to us all the time, we are something different than that. We're the receiver of all of those experiences, and we become more ontologically aware of that experience of not being those things, and having them be a very significant part of our lives without actually collapsing ourselves or conflating ourselves into any single one of them when we meditate. So a good, having a meditative practice, a Tai Chi practice, a Qigong practice, a yoga practice, having gratitude, watching what we put in our mouth and who we hang out with and what kind of toxins we're taking into our system one way or another, and keeping ourselves flowing and hydrated, as well as creative and then connected to spirit, as well as being out in nature, taking care of our basic needs and pampering ourselves, and ultimately being of service to others. These are some of the things that, in fact, actually have a direct and obvious effect on how our nervous system's running at any given time. And if we are able to incorporate those things into our life, into our otherwise extremely busy, challenging, obstacle-filled life, I think we have a chance of setting ourselves up for a properly massaged nervous system that is then more likely to get the positive response from formal tinnitus treatment.
I love that. I love that. Well, let's talk about perhaps a 5-minute daily practice. I'm hearing you share the list of things. I'm imagining my community listening, who I speak with a lot, and they would say, oh my God, Fred, that was a lot of things. I don't even know where I should start. I don't have the time for that. But I know that a 5-minute, who listening doesn't have 5 minutes. They could wake up 10 minutes earlier. They would have 5 minutes. Let's be real. Everyone has 5 minutes. So what would you say is a good starter pack for someone who has done none of that?
I think what I said before is that you have an opportunity that being loud is a comparative term. And when we start changing, the variable is what we expect. It's how it is versus what we would expect or want it to be. So when we can really take a look at being present with what's so, really, like actually being present with what's so. There's lots of things out there that are very perturbating, very disturbing on multiple realms. We're present with those. We know that they're there, and yet they don't interfere with our day-to-day sympathetic, parasympathetic activity so much. Tinnitus is a different one because it's, it emanates from within, and it's it's annoying, especially annoying if what we're expecting is quiet. And so, one of the things when you talk about a 5-minute practice, I think the first one is really important, would be gratitude. So before I even get out of bed, I put my hand on my heart and I say a certain prayer, and then I go into gratitude. And in that gratitude, I list 10 things that I'm entirely grateful in our present world. And since I sleep with my wife, she's always number one on that list. And, and when she's not with me, I still keep her as number one, just to be honest. I have these 3 amazing cats as well. So I have Despacito, Winston, and Valentino, who are my little family here up in Northern California. And they make it to either number 2 as a collective as my cats, or number 2, 3, and 4 if I'm in a hurry. And I just go with that. And now I only have 6 left. Then I might go with the food in the fridge. I might go to the sun or the moon out there. I might go with my friend or mentor. I might go with my sister. I might go with my kids. I might go with the fact that the air is breathable. The air is like breathable. I might go to the fact that I woke up again. Right there, I've already named 13 or 15 different reasons to be grateful that each of us have some version of. Not everybody's got 3 awesome cats and an amazing wife, but you get my point in the first place. So gratitude is a really easy one that I do in about 10 seconds before I'm actually out of bed. So those 10 things take me about, 15 seconds maybe to say them out loud, whisper them, and be really real with them. Then I get up and I step outside. Sometimes I might have to, do my bathroom stuff first. And then I step outside and I get myself a breath of fresh air. I get myself to feel what's really going on in the great globe here. As we tend to stay at home. We tend to stay at home and stay in our cubicle or stay between our 2 ears, which of course is where tinnitus lives. And we just stay and focus in that and call that our life. But that isn't really where life is occurring. Life's occurring in this big, incredible globe, this big, incredible planet that we live on. And so I step out and I noticed today was very foggy. I was out there at 5:15 and it was very, very foggy. And it was like, okay, that's worth knowing. I'm not going to be able to see the stars, but I can see the dew on the leaves and I can feel the air. And I did my stretching out there. And it was, again, maybe a total of 1 or 2 minutes. So now we're looking at so far about 2.5 minutes, which means I have 2.5 more minutes to do. So whatever I do there, I can sit with what's so and plan my day and maybe plan how and where I'm going to be either creative or of service. How and where am I going to be creative or of service? Who can I help today? Like, really, who can I help today? If you want to get rid of an ailment that you're having, the best cure for an ailment that you're having is to go help anybody do anything. That will serve us up, not only to sort of put what we're concerned with on the back burner, but to actually decrease the intensity of what's going on. Or maybe see that there are people out there who are in more need than you are in many different areas of life. Again, not in any way, I hope you get, Ben, not in any way to diminish the power of what ongoing tinnitus really does, the wreckage, the ruinage that it can cause in people's lives. I'm not here to do that. I'm just saying that in this process, we can put it in a deeper perspective as, indeed, a condition of the game. So those are a couple of the things. And I think, another thing to do, and I'm not sure how this ranks up with tinnitus, but I know that it really alerts me without having me become hypervigilant, is I take a cold shower every single morning. I haven't missed a cold shower in 3.5 years, and I don't plan to miss one tomorrow. I've got one in already today. It's all good. And there's something that really awakens me and awakens all that's here and gives me a purified look at how the world really is after or during my cold shower. Mine are 3 minutes long. If you've never done one, I would expect you to maybe just do a couple seconds. Just turn the water down at the end of your shower and just appreciate it. And you'll find that you really are drawn to it before too long. You'll want to do 5 seconds and then 10 seconds. And a cold shower can be very therapeutic. And I'm not sure, I honestly haven't done any research about the interface between cold showers and tinnitus. And I sure hope I'm not suggesting something that tends to make tinnitus worse, but it doesn't for me make it worse. It very much just opens up my eyes without leaving me in a hypervigilant neurologically triggered state.
So Fred, two themes I'm hearing there are mental perspective, changing our nervous system state, even shifting it slightly seems like is recommended, which I love. And the second I see just a theme is activating the body a bit, kind of getting out of this heady cognitive tinnitus stuck in my head and engaging with nature, engaging with my body, doing some stretching, having cold shower or going in, a cold body of water. So for those listening, just a review of that for, Fred's 5-minute recommendation here or suggestion is gratitude, even 1 or 2, just things that I'm grateful for. And then some movement, stretching, stepping outside, taking a big breath of air outside, doing something for yourself. Don't go straight to the phone, straight to the TV, straight for the food. And then third, self-care, shower. It's almost an example of something that doesn't feel good in the moment, but when it's done, we're glad we did it.
Sure.
Now, Fred, I love that. I want to jump to the next component of this, which is equally important because a lot of our patients at Treble Health that we work with and just clients in general, there's 2 things that I like to look at. One is a proactive nervous system health component, which is what we just spoke about as an example of, okay, every day I'm going to try to do things that keep my nervous system in a good place or make it better at a baseline level. But then there's when life gets out of control, when I have a spike in tinnitus, when things get overwhelming and the tinnitus goes crazy, I'm stuck in the fight or flight. That's a heightened nervous system state in the acute phase that we're trying to bring down a few notches so we can go to sleep or be present with our family or not go crazy. What's your perspective on that? Because I know you have a lot of experience working with clients for that.
Yeah, I do. And, I think the first place I'm going with this, just to let you know, again, having unrehearsed this all the way through, which it should be that, is be very careful of psychiatric medicines in that situation. Be very careful assuming that psychiatric medicines either do what they say or are going to actually be the soothing agent. You had mentioned earlier that you thought psychiatry had done very well with or at least had taken on what was self-responsible for taking on depression, anxiety, and insomnia. And although people come to us with those conditions, they often get put on these medications, which tend to make people worse in many different areas, and certainly can actually add. And there's, the side effect profile of all of those drugs have tinnitus somewhere down the list as being one of the things that it can cause. And I just wouldn't be in a hurry to use the medications that were created inside of laboratories to deal with any of that in the face of trying to decrease our tinnitus. So that would be my bent on that. As the undoctor, I unmedicate, I undiagnose, unmedicate, and undoctrinate people because I'm not really certain that giving them a diagnosis, I am actually pretty certain that giving them a diagnosis is traumatic in its own right, and that the medicines often create the symptoms they're marketed to treat, and I'm not aligned with that. And, I took an oath back in the day, 40 plus years ago, actually 36 years ago as a psychiatrist, the idea of first do no harm is something that is really important to me. So I'm really careful about putting meds into our mouth as a response to doing this. Now, some people have found that there's some herbal tinctures or there's some extracts out there that can be very helpful. And that can be anything from the herbal teas to some of the flower essences to some of the natural ingredients out there that have been used. Chamomile, for instance, been used for, I don't know, thousands of years to help us calm down, and lavender and peppermint and rooibos and all those herbal tinctures that can really help us with all this. But I think what we're really, really going to be looking at here is how can we step in? I kind of forgot the essence of your question right here, and I want to roll it down. So if you can, I know I've been buzzing around it, but help me get back to what.
Yeah, we'll jump to the question here, the core question here, and then we'll come back to the other pieces. Core question was, when I'm in an acute phase of a heightened nervous system, what are some simple tools in my toolkit that work for most people to regulate and bring us down a few notches?
Yeah, and I think, again, we're back to this idea that sitting and then keeping ourselves hydrated, getting the flow going, and then seeing our life as much broader than what's going on between our two ears is at least one aspect or one direction to point. It's not a matter of denying the impact. That's really important. It's not like trying to get over it. It's trying to incorporate it into what's so. It's really important that you get that in. We're not fighting it to beat it back. We're actually acknowledging it and then incorporating it into our life's landscape. And I think when we do that, we have a better chance of not seeing it as an intruder that we have to combat and destroy, but something that we can incorporate, understand, and be with. And I think when we do, as already discussed, when we calm our nervous system by sitting or by finding ourselves in self-pampering, by nature will decrease the intensity. So becoming all excited about tinnitus being there is actually feeding it the food that it needs in order to become louder.
Yeah. Thank you for that. And I also wanted to highlight here that for anyone listening who said, "Oh my God, I have taken medications for my tinnitus. Oh no, I am someone who maybe I'm on the wrong path." Let's speak to them for a moment.
Yeah. So under no conditions am I giving you any kind of medical advice to not take your medicine. I'm not doing that at all. I'm just saying that it may not be the top line thing to do. There are many things that you can do, and some are more effective than others. The fact that you've taken medicine or that you're not a bad person. You didn't do it wrong. You didn't destroy anything. Many people are taking medicine these days. Like that's at least how many it deserves. And the idea is that sometimes the medicines don't do exactly what they say. And you may have already experienced that as fact, when you took the medicine, like it caused this or that to happen, untoward outcomes. Or maybe it didn't help you with the depression as you hoped it would, or the anxiety as you hoped it would. And you may already have that experience, and that's the group I'm speaking with. Now, there's one other group I want to address, Ben, and that's the group that was presently actually controlling themselves with medicine and feel like they wouldn't trade that treatment plan for the world. Like they have found it, it works, that's what they're doing. Forget anybody who says to come off the medicine because it's my favorite thing in the whole world to deal with my tinnitus the way I do. by all means, keep doing exactly what you're doing. No kidding. I'm not, it's like more power to you. If you come to a space in your life where you wouldn't trade something you have for anything else in the world, like, congratulations. You need to bottle that experience and keep doing exactly that, because that's a rare experience to have in this human life. It's just mostly for the group of people who are still struggling, who've tried certain things, whether they be benzodiazepines or antihistamines or sleep assistants or antipsychotics or any of those drugs, antidepressants, and it hasn't worked. I'm letting you know that's right. It sometimes doesn't work, and it's not that great of an idea to keep banging on that door when there are all these behavioral strategies and tactics that are available that can have a much larger impact than the SSRIs, the benzos, and the antihistamines, as well as any other sleep, top laboratory-based sleep substances that have been created. Again, I'm not so far behind on the herbal substances. I do like the herbal substances and the flower essences. I just think that they're mostly very, very effective, very gentle, almost put on earth for us. Whereas the other things are things that we created on our own in the last 50 or 100 years, which may not have that pure essence.
Totally hear you on that. Well, we do know that medications are a topic that people ask about. We are looking for it to some degree. Now, in my understanding, there's no medication that has the sole purpose of reducing tinnitus. Sometimes they're used for these indirect assistances, like tinnitus causes insomnia. Medications might have been used for insomnia. Tinnitus causes severe anxiety or panic. Sometimes medication can be used in that place. So I just want to highlight anyone here who's in that journey, different spots of that journey. Do consult with the doctor who you've been either getting medication from, discussing it with. And we brought Dr. Fred on our podcast because there are different perspectives, and each individual should know and hear from different smart people of different ways to approach this. Dr. Fred, let's jump into insomnia, sleep difficulties, because from what I've heard, there's a protocol that we use a lot with our patients, cognitive behavioral therapy for insomnia. We modify it a bit for tinnitus specifically. We incorporate some what's called sound therapy strategies around that, and that works very well. And I've even heard that CBTI for insomnia by itself, not tinnitus, has been studied, and it does quite well against medication interventions for insomnia. So could you talk a little bit about sleep and top tips for that? Tinnitus affects people. Sleep is the number one issue for people with tinnitus.
Yeah. So again, I have an underlying emphasis here on be very, very, very wary of sleep medications that are created in laboratories. These sleep medications were never designed to be taken daily at all. Even on the bottle, when you first get them, they say that, to take them for 2 weeks and then stop. And most people don't do that. These are powerful drugs that are affecting your circadian rhythm directly and from the middle, and usually aren't serving the purpose that they're intended to do, at least not well enough to be something that can be incorporated into a day-to-day lifestyle. It also tends to cause, the medicines that we've created, whether they be the Ambien-based medicines, the non-benzodiazepine sleep assisters, which are often the antihistamines as well. And then we have the antipsychotics that are often used that way, like the Seroquels that are used, which is basically 100% was designed for schizophrenia. And I'm not sure that you want to walk into that market. It's like, using a tank to kill a fly in some ways. So I think you have to be a little bit careful about that. And I think that when we start looking at sleep essence, what we need to do, what the best thing that I have learned to do in the world of sleep hygiene is to prepare ourselves for the sleep phase at the similar level that we prepare ourselves for the wake phase. So when we wake up, we go through a whole protocol before we're stepping outdoors. We have to do all sorts of things, from getting dressed to finding our purpose, maybe taking care of our kids or taking care of our food situation, or getting our hair right, or whatever we need to do. There's a whole protocol that moves us from getting out of that bed to getting out in the real world. Imagine if we took a little bit of that energy and actually provided that protocol to the front end of our sleep journey. And so that what we would do is we would certainly turn off all of our electronics way earlier than we're presently doing it. I am no good at this either, by the way, but that includes not only my phone, it includes my TV, it includes all of my computers, it includes anything that has pixelated lamps. Pixelated lamps in and of themselves are flashing little lights that in their own way are like a visual tinnitus. And when we start getting pixelated lamps delivered into our eyes to the very end before we try to fall asleep, we could see that we're actually feeding fuel to the fire. We are actually, like, the number one enemy of sleep is light. And so we watch these lights, even as you and I are having this conversation right now, we're pretending we're with each other. No, we're not even close to with each other. We're both staring at billions of pixelated lamps, and they're doing what they're doing to give us the illusion that we're with each other. And we're not. We're just simply not. And the same holds true, of course, with our auditory. There's no sense that you and I could possibly hear each other, but we're running it through these high frequency waves that are coming where we're coming, and I invite people to turn down that stuff a lot, an hour and a half or 2 hours before they go to bed. Now, some people are like, I can't turn them all down. The TV runs in the background. Okay, if you can't turn them all down, just turn down as many as you can turn down. And then give yourself an opportunity to pamper and to soothe yourself, to smooth yourself into the transition to what sleep is about to look like. That might include taking a warm bath, a warm bubble bath. There's nothing more glorious ultimately than a warm bubble bath. And, people who I've had like big, hefty men decide to take warm bubble baths, and all of a sudden their sleep, in the world of treating them for sleep disturbance and not necessarily with or without tinnitus, like taking a bubble bath, getting the music down, getting the light down, doing fine hand-eye coordinating things like maybe knitting or crocheting or origami or something like that, like doing those kind of things that are all very calm and very easy and then very soothing and set us up for the relaxation that is required in order for us to actually conk out and fall asleep. So that would be one thing, is like paying sacred attention to the hour or two that is now being set up as a preliminary to your sleep efforts. And, as far as drinking stuff or eating stuff, I've already said, I like the herbals. I like the flower essences, and especially the ones that are geared towards relaxation. And then sometimes even warm milk with the tryptophan that's associated with that. But coming from real milk rather than some sort of chemical-based, plastic-covered tryptophan, some number of milligrams, although it might be effective, I do suggest that if you get it from a natural source, it's likely to be a little bit more pure.
All right, guys, no shortage of ideas for you to try here. What would be a shame, Dr. Fred, here is that if someone listening who is struggling with these issues listened to all these suggestions, all these options, but didn't try anything. So I encourage everyone listening to rewind if you have to. Take a few notes. What are 2 things you could try in the next 7 days? That's my challenge to you. Comment below after you try those. Come back to this video. Dr. Fred, I know that you have different offerings and programs available for people in your community. I'd like those in the Treble Health community listening to be aware of them.
If you're interested in that and having a conversation with me about that, you can find the contact button at drfred360.com. Just put that in the comment, and then our team or myself will call you back and we'll have a good conversation about whatever it is that's on your mind.
Dr. Fred Moss, thank you so much. For those listening, the nervous system is this unknown, invisible part of tinnitus care. Trust me on this one, that if you stick to the fundamentals of tinnitus treatment and include nervous system, anxiety management, stress management, your physical health, sleep, things will start to get a lot easier. If you need help, definitely reach out to a specialist. Dr. Fred Moss, thank you so much, and we love what you're doing.
Thank you, Ben. Appreciate it very much. Great conversation.